Hello, this is Dr. Jeon Inseong from Dental Bean. Today's patient is a 28-year-old female. The main reason for her visit is that number 11 and number 21 previously underwent root canal treatment, but number 21 is currently almost fractured. And since the condition of number 11 isn't very good either. In cases where both central incisors have problems, treating them together can help prevent the spread of inflammation and ensure better aesthetic results. The patient has consented to the treatment plan for extracting both teeth and placed 2 implants. We've already taken an alginate impression and created a shell using CT scanning. The shell has been fabricated to match the patient's teeth, and if primary stability is sound, we plan to proceed with immediate loading. There is slight inflammation in the gingiva around number 21, so we plan to graft soft tissue to improve the biotype, making it denser. Let's briefly take a look at the preoperative photos. There is a persistent sinus tract here. This tooth is fractured, and number 11 is also in poor condition. The implant to be used today are Dentis SQ implants, with 2 fixtures of at least 4.0 by 10 millimeters will establish primary stability, and by using the prefabricated shell, proceed with immediate loading. Post-operative observations are as follows. 4.0 by 12 millimeters was placed on both number 11 and number 21, with about 30 Newton centimeters of primary stability. The depth from the gingiva was precisely controlled to be at least 5 millimeters. And number 11 region was filled with PRF. For number 21 region, connective tissue was also grafted. This is the 11th region. We placed it while visually confirming the position, and it is properly seated on the palatal side. Shall we take a quick look at the number 21 region? As you can see, the implant on the number 21 region has also been well placed, and it is also seated on the palatal side. For this patient, we used the prefabricated shell printed with a 3D printer. We performed slight under contouring to allow for gingival growth. We'll complete the final prosthetics and provide a follow-up report in about 3 months. Thank you.